And folks, if you are watching right now, please stand by. We're waiting for the Facebook Live stream to establish. And I believe we're there. And let me hit the share button. All right. Good afternoon, folks. Tim Radford here on WKRK in Murphy, North Carolina, 105.5 FM, 1320 AM, cable TV channel 25, and worldwide at WKRK.love. And this special edition right now with Dr. Terry Fokakis is on Facebook Live. So, and because some people may have some issues pronouncing Fokakis correctly, he says it's totally fine to go with Dr. Fo. So, good afternoon, Dr. Fo. How are you?
And doing great. Thanks for having me, Tim.
All right. Well, we welcome you to Erlanger Primary Care and welcome to the Murphy, North Carolina, Cherokee County area. So how long have you been here in the area?
I got here in July and, right at the peak of COVID, the best time to get here. And so basically we settled in and started work in September.
So tell me a little bit about your career, your education. How long have you been practicing?
Yeah, so I am originally grew up in Mississippi, South Mississippi, and went to Mississippi College for my undergraduate work. After I finished up college, I decided to move to a city, so I moved up to Chicago, lived up there for 5 years. Did marketing, something totally different than medicine, which was fun. And then we ended up going to graduate school up there at Midwestern University, got a master's in biomedical science. And then after that, went to medical school back in Mississippi, and then went to Texas for residency and ended up here. So kind of a roundabout way to get to North Carolina.
All right. So not all of your areas are as extremely rural as Western North Carolina. What are you finding that you like about Western North Carolina?
Yeah, it's to be this time of year in this area. I mean, the trees are changing. It's gorgeous. I mean, just the landscape in general is amazing. I think probably one of the biggest things that I love about the area, though, is the patients. The Murphy in and of itself is kind of like its own little melting pot. You have people from all over, and you hear some fascinating stories when you're seeing these patients and what brought them here and circumstances about their life. And it still has that Southern hospitality to it. So, I mean, this area, it's really hard to beat.
Absolutely. And anytime I find anybody from out of town that has moved here, I always ask them, how in the world did you find little bitty town of Murphy, North Carolina? And I love hearing those stories.
Yeah.
Well, tell us about what drew you to your passion of family practice. You said that you were marketing at one point, but what's your passion about family practice?
Yeah, I've always loved medicine, always been interested in medicine. When I got into medical school, basically your third and fourth years of medical school, you're doing rotations in different specialties to figure out, what you want to be when you grow up. And I remember going on every single rotation, whether it be surgery, OB, family medicine, hospitalist, and I couldn't find anything that I didn't like. I mean, I even loved doing the psych ward. I mean, every aspect of medicine I found interesting, and really the only field of medicine that you can actually bring all those together is truly family medicine. I mean, I can walk in one room and see a patient for their diabetes, and I can walk into another room and see a patient for their depression or anxiety, and then I can go into the procedure room and perform a procedure in the middle of all of it. So it's the best of all of medicine in one.
So basically, families out there can just bring their entire family to you, and you can, and that's kind of a convenience factor too. And if you find a doctor that you really like, you really trust, why not bring the entire family?
I think that's a great point. And you know, the great thing about having a whole family within your practice is that I know what their husband's doing when they're not there. I know what their daughter's doing when they're not there. I mean, I feel like I'm truly a part of their family. I mean, you know, in the past, I've treated great grandmother, grandmother, child, and then the grandchild. So it is just, it's fun to be a part of that multi-generational medicine because it's so different and it's so fun.
I can see also there being another advantage. Anytime I go to a doctor or any kind of healthcare provider, I have to fill out the fun paperwork. And on that paperwork, it asks about family history with medical conditions. And I honestly don't know the answers to those questions. So if everyone is going to the same doctor, you pretty much have access. You know what's going to, you know, what kind of history is going on with other family members, and you can kind of piece that together.
Oh, you absolutely can. You know, we see that a lot. We'll say, you know, most of the time, a lot of people's physicians will ask them, "Hey, does anybody in your family have heart disease?" And they'll say, "I don't know," you know, but I may be taking care of your grandfather, and I know for a fact that you know that he's had problems within that area, and so it just makes it a little bit easier, and it makes the process easier overall. And you know, honestly, when you form a medical home like that, you know, you're able to follow people's labs, people's blood pressure. You know, you're really able to watch the change that occurs from visit to visit.
You mentioned medical home, and I've talked about that with a few other physicians here from Erlanger as well. And I didn't know what that was at first, but I found out quickly that it's basically having all of your information, all of your records in one place so that it's your information is not spread across the tri-state area. And one doctor knows this about you, and one doctor knows this. How important is that for a person and a family?
Yeah, I think it is extremely important. You know, sometimes patients will go, you know, will have many different doctors. They may have a GI doc that they have to see and a cardiologist they have to see. Really, your medical home takes all that information and kind of puts it in the medical records to be able to easily find stuff, see when your last colonoscopy was, you know, what medicines we've tried, you know, certain labs that we've been following for a while, and it's just, you know, to be able to have that spot that you can call if you move to a different area and say, hey, can you send my records? All, you know, the nice thing about a medical home is that they have all those records and they keep it all updated, and so that's why it's really important to have a medical home. You know, here we get all discharges from the hospital too. So we're able to keep up with what happened in the hospital too, if there were med changes or not. So I can't stress how important it is.
So if I were to go to you for one issue and then go to another doctor for another issue and then maybe another doctor for a different issue, are you able to automatically see what the diagnoses are and what medications have been prescribed, or only what's there in the file in your local office?
Yeah, so you know, it depends. You know, unfortunately, all the EMRs are not linked up. Most of the time, if they're within our clinic system, within under the Erlanger umbrella, we're able to see those. If they go kind of out of state or to a different physician or that's not part of our group, what we'll do when they come in is have them sign a release form so we can get those records, and then we kind of compile it. You know, and a lot of that takes place sometimes during the interview when we're talking to a patient, and then sometimes we get them weeks later, and so we go back in and make sure everything's tuned up within the chart so we can make sure to follow along with specific issues.
All right. Well, it's National Caregivers Month, and I know women especially, they'll sometimes neglect their own health to make sure that their spouses or their kids are taken care of. What important information or recommendations do you have for women or anyone who may be neglecting their own health?
Yeah, I'm glad you brought this up. I love women's health. Part of my residency training, we focus a large part on women's health, and that includes, ages 18 to 75 and on. And so, National Caregivers Month is really about reminding these caregivers that they have to take care of themselves. And if you can't help someone else if you're wiped out, if you don't have the strength or the energy. And so that's why it's so important for our mothers, daughters, grandmothers that have always been those main caregivers for the family to come in, get checked out, make sure that you're up to date on your immunizations, your yearlies, your labs, make sure you're on the right medications. It is very important to stay healthy so that you can keep someone else healthy. It's hard to give something away that you don't have.
All right. I'm going to mention this too because I know a lot of people have differing opinions of the flu shot. There's a lot of folks that are completely anti-vaccination folks, and some people say they get sick with a flu shot. And especially right now with COVID-19. Yesterday we saw our 21st death in our county from COVID-19. And a lot of people are still getting sick. A lot of families are getting sick, and a lot of clusters are happening where a lot of people in the same office are getting sick. So I know one of the things that stuck out in my mind one time before when we were reporting on COVID-19 cases, someone said, "Well, why aren't you reporting on flu cases?" Well, at that time it wasn't flu season. Right now it is flu season. So a lot of the symptoms of flu and COVID are similar, and people may be confused about what they need to be screened for. So, what do you have to say about the flu shot as well as COVID and flu symptoms?
Yeah. Just to kind of to touch base a little bit on the importance of COVID and what's going on. I mean, if you look back last year, right, and you look at the deaths from the flu last year, it was about 60,000. And then you take into account what the deaths are compared to COVID-19, and we're over 200,000. And so, the recent literature shows that COVID has become the third leading cause of death in the U.S., which is kind of mind-boggling if you really think about it. I mean, most of the time that's reserved for like breast cancer or prostate cancer, and that's surpassed that. So, it's a very, very serious time to be in the medical field and for everybody across the world in the U.S. I think the one thing that I know that most physicians have worried about, and we've talked about it since back in March and April when coronavirus first came in, is the confusion that may occur during the winter months, just because you're right, the symptoms overlap so much. Sometimes it's hard to tell. The flu shot is not perfect by any means. It truly isn't. I think last year it was about 40% effective, but I can't stress how many patients that I observed last year, that the ones that got the flu shot and the ones that did not get the flu shot, their symptoms were significantly different. The ones that seemed to get the flu shot, their symptoms were mild. They had a mild cough. They weren't super sick. The ones that didn't were the ones that I'd walk into the room and they'd be sprawled out on the exam table and say, please, please, Dr. Foe, help me, Um, and another kind of boost for the flu shot is what they're noticing now. There's some recent data posted last week that found that people that got flu shots in the years prior, now that they're if they get COVID, their symptoms seem to be less. And really, the question, the scientific question that they were asking was, is the flu shot maybe helping prime our immune system, get it ready if we do get something like COVID. And so, I can't state enough how important the flu shot is. If it can keep you out of the hospital, keep you safe, it should absolutely be done. I get the flu shot. My wife gets the flu shot. My children get the flu shot. I love to, I think the important thing is when you talk to your physician, always ask them, say, hey, if this was your mom or this was your child, what would you do? And I say it all the time. I say, hey, I get it. My wife get it. My kids get it. It's important. And so it kind of helps people realize that, if I believe it, hopefully they'll believe it too.
I know if we were talking about COVID-19 in a non-election year, the focus probably would have been more on the actual virus than the politics of everything that's going on. With that in mind, what would you say is good information for folks out there? Is the mask important to wear? What kind of, from a medical standpoint, how should people treat and prevent themselves from getting COVID?
Oh yeah. This is a great question. I think what we're seeing now is that the data on mask, it's actually really good. I mean, some of these surrounding, where we're seeing these hot spots of COVID recently is in areas that don't have mask mandates, right? And so, if we can prevent 100,000 deaths over the next couple of years with doing a mask mandate, I think it's so important. I personally, every time I go out, I have a mask on. If I'm exercising, I don't. It's uncomfortable. I'm away from people. But if I'm in any kind of store, anywhere, I wear a mask. Unfortunately, I think a little bit of it's become slightly politicized, kind of like you said, within, a political year. And I hope that moving forward that, if we can prevent our grandparents and our parents from getting sick by wearing a mask, I hope we'll all jump on board and do it. Like I said, I'm doing it. My kids even wear masks, my 5-year-old and my 3-year-old. It's just kind of become a part of life. And, if we get this thing under control, I really do believe that we'll go back to a normal way of living. It's just going to take some time. There's always bumps, and it's kind of like a roller coaster. So you go up and you go down, unfortunately.
Well, I've known several people who have died because of COVID-19 now, sadly, and a lot of those people really had no other underlying conditions. And one of the arguments is that it's not the COVID that kills people, it's the underlying conditions that kill the people from this. So they're trying to use that argument. And I understand they're wanting to understand it. What does COVID-19 do to those? Is there an acceleration of worsening of those conditions usually?
There is. I mean, what we're seeing with it, I was in Texas in the middle of the pandemic. I was in the hospital. We were taking care of patients, and that was really before we knew a whole lot. As time goes on, just like with anything, we learn more. And what we've seen is that some of the people that are the most highest risk actually fall into the obesity category. Why? I don't know. Science doesn't completely know. There's some thought that there could be, increased inflammation overall. Yes, overall there's a higher risk for patients that are older and that are heavier. And even, there was one time thought that asthma, and there's been kind of back and forth whether asthma is a big risk factor. But I can tell you, there in the medical literature, there were 2 recent reports over the past year of 2 residents who died from COVID-19. And I believe both of them, if I'm not mistaken, were OB-GYN residents. So that basically means that they got out of medical school, they were doing their residency and they were about to transition into working in a hospital, and they were young. They were 28, 25, 28, somewhere in there. I'm 36. That puts me at higher risk than they are statistically. But we don't know. We don't have all the answers yet, and I think over time we will. And I'm sure there's some kind of gene that plays into effect that makes people more susceptible. Unfortunately, it's just gonna take time.
Someone who has had COVID and are now clear and symptom free and no longer in quarantine, are they able to get COVID a second or third time?
That they are there have been case reports of this occurring, and it's even thought that in some reports that the symptoms could be a little bit worse the second time. And so if you've gotten it once and you survived it, or if you were in the hospital for a long time, multiple weeks at a time, getting it again, you're not protected from it. We don't have all the answers on antibodies and things of that yet. So there's absolutely a chance that it could be worse, and that time it could be fatal.
Hand sanitizer, this stuff right here, you can't see it because of the green screen, but
Or
do you
same.
recommend, yes, that stuff, right?
Yep. Yeah.
Do you recommend using hand sanitizer or washing with hand soap and water?
I think either. The nice thing about the coronavirus and all coronavirus species in general is that they're susceptible to hand sanitizer. It's amazing that something as simple as that could potentially prevent the effects of COVID. And so keep one in your car anytime you get out of a store or a restaurant. I would recommend going sanitizing really well. My kids have gotten to the point where they call it Hanitizer. So they shorten hand sanitizer. So it's important to prevent the spread of COVID. And if you got a way to eliminate it, I'd say do it.
I think this may have an effect on how we observe, our social interactions going forward. I'm the kind of person I hug and shake hands, things like that. But right now, people like myself, I think, are a lot more aware that that is how things are spread. Do you see things that have happened during COVID-19 may extend years into the future and just change our social interactions with each other?
Yeah, yeah, I do. And unfortunately, I think it's going to tend to affect the younger generation, the kids that are watching this, my children, other people who have young children. I think we will see at least for a couple years, a change in the way we greet people. If some people are uncomfortable when they come into my clinic, we nux instead of shake hands. I've had a couple people, I'm a shaker, I'm a hugger, and I've reached for it, and they've thrown up the fist. And so I know, hey, we'll do it that way. And so I do think it is overall going to affect, particularly the younger generation and people with underlying mental health issues such as anxiety. That right now is kind of one of the main talking points that I've seen in the medical literature, is the psychological effects that this is going to have on us in the long run, whether that's anxiety or depression or PTSD. So I think even after we get rid of the virus, there will be a lingering effect of its presence around.
And just to clarify, shaking someone's hands, that's not how it's actually it doesn't soak into the skin, but once you touch your eye or your mouth or anything like that, that is how the contact is made, correct? Not just
Right.
by shaking the hand. So if you shake hands, immediately wash or sanitize, you're okay.
Yes, that is the thought. And if you're close enough to shake hands and you don't have a mask on, you're pretty much you probably have already gotten it. So.
I learned about contagious diseases when I went to school, and there was a salad bar and that cover over there, the sneeze guard, which I hate because I'm pretty tall and I have to like get down sideways to get the salad out. So there is trying to protect the food from germs like that. This is pretty much the same thing.
Yeah, exactly the same thing. And that, I mean, that's kind of the purpose of the mask. It prevents transmission. It can prevent transmission for people who have it and people that we're trying to prevent from getting it. And so it serves as a barrier. It really does. So.
All right, we'll get off the topic of COVID and go to medications. Managing medication, and I know some people they take a dozen pills at one time because of all the different conditions, and there's concern about perhaps some of the medications interacting poorly with other medications. How do people know that what they're taking is okay? What's been prescribed is not damaging them because of interactions with other drugs?
Yeah, I think that's why having that medical home, I can't iterate how important that is. Just anytime a patient goes to another physician, sometimes the EMRs are not connected, kind of like we talked about earlier. And I like to joke, I like to say that there's a bunch of cooks in the kitchen, right? If everybody's cooking, it can get a little messy, and so sometimes you need that head chef in there to kind of help things out. And so that's where your medical home and your primary care physician really comes into play, is making sure that the medication that the cardiologist has you on is not going to interact with your diabetes med that I have you on or your endocrinologist has you on. And so we really try to make sure to go through those meds and make sure that there's no interaction. When I see somebody for the first time, you can ask anybody that I've seen. My spiel is, hey, this is going to be the longest visit that you and I will probably ever have, and that is because I want to make sure that I got all your history and the meds that you're on, and that they are correct, and that I'm not missing anything that could potentially be causing problems. And and people actually are very nice about it. And I never want to take up somebody's too much of somebody's time, but I also want to make sure that when they leave my office, I have an understanding of their medical history, the meds they're on, and that I know that they're walking out the door safely on those medications.
And it could be a similar situation as you go to your doctor, and then maybe you go to your dentist, and the dentist prescribes something. I mean, you're not going to ask dental work about your doctor or things like that, but I found out myself I was taking two different medications that did not do well together, and thankfully the pharmacist caught that and said you do not need to take these two things together. So there's always the pharmacist too if you are having to go to different types of doctors.
There are. The pharmacists are great. I always appreciate when they call me and they'll say, hey, there's a better price on this medication, or there could be a potential interaction. The nice thing about medicine and being a physician and going to residencies, you learn a lot about that, and there's a lot of theoretical interactions that don't occur, and we know that as physicians, and sometimes pharmacy may feel a little bit uncomfortable, and so I'll usually pick up the phone and say, hey, we'll talk about it a little bit more and kind of reassure each other that we're doing the right thing together.
All right, sounds great. Was there any topic that I haven't talked about or asked you about today that you like to talk about?
The only thing that I can think about is for the younger women out there, 18 and above, 18 to 40, up to 50. I just want, they need to know that, here at the Erlanger primary care clinic, we do have family medicine now, and family medicine is trained in birth control and preventative of pregnancies. Whether it be, something that's as effective as like a tubal, such as the Nexplanon or an IUD, we do those here. So now you don't have to worry about getting in to see your OB-GYN. I know we've we've lost that in the area recently, and a lot of people have been traveling outside of the state to get that coverage. We do it here. We have that ability, and so we will be happy to take care of you. Preventative help, whether it's Pap smears, breast screening, breast cancer screening, colonoscopy. I mean, we have the gamut here. We are here for the area of Murphy, North Carolina, and we want to make sure that we help this area become healthy and stay healthy. And we are here for the long run. I mean, that's why we chose this area, is to make a difference and be a part of the community. And so, just kind of, come see us. We'd be happy to see you.
All right, Dr. Foe, just want to clarify and let people know the address of your location. That is Erlanger Primary Care at 183 Ledford Street in Murphy. And most people, everyone knows where the log cabin, the urgent care is. And you're the same building. Do they use the same entrance or a different entrance?
They use the exact same entrance. I think there's been a lot of confusion about that over the years. We have two docs in this building, and over here that are seeing patients full time, and that is outside of urgent care. Urgent care. We recommend people to go to urgent care if they're unable to get in with their primary physician or their physician out of town, and they have, a single issue that is urgent that needs to be cared for, and it's not an emergent situation where they would need to go to the ER instead. And so, we have that, and we've been, if people are coming in and they've been here for a while and have used urgent care only as their primary care, we've been handing them cards and saying, "Hey, come. We need to make sure you got a medical home."
Well, I think a lot of people have gotten used to using urgent care because at one point our health care provider list was pretty small, and a patient would call up and get try to get a new appointment, and the provider would say, "I'm sorry, we're not taking any new appointments. We're full," or "Your appointment is 3 months out," and some folks could not wait for that. So has that situation improved here lately with Erlanger?
Yeah, significantly. I mean, now if you look at it, we have 5 new doctors across the area, 5 new primary care doctors, 3 of those being internal medicine, 2 of us being family medicine. And just to clarify so people understand the difference between family medicine and internal medicine, is that internal medicine basically sees anybody 18 years and older. Family medicine sees, I've seen as young as newborns up to elderly. So we're kind of fully trained from, young and old. Internal med usually focuses on 18 and above. So just to keep that in mind. But now, I mean, we have people coming in, and I've literally had 3 patients over the past 2 weeks say, "Please don't leave," right? And I just want people to know that we are here. We're not going anywhere. This is where we chose to come to make a difference and to be a part of the community. And we are happily taking appointments. You can get in as quick as less than a week right now. And, we've always told our patients, Dr. Gilmore and I, and Dr. Irwin, we've all talked about that. If you need to get in to see your primary care physician because it's an issue that your primary care physician is familiar with, we will always take a walk in. And see that patient for that complaint. It's always nice to have that person that knows you and you can trust.
Right. All right. To schedule an appointment, you can call 828-837-4712 for Erlanger Primary Care. Again, that's on Ledford Street in Murphy, North Carolina. I think that's within the city limits of Murphy too. So real convenient for folks. It's the log cabin, also housed with the urgent care. So 837-4712. And Dr. Fokakis, we appreciate your time today, and welcome to Western North Carolina.
Thank you. Thank you, Tim. I appreciate it.
All right. Have a great day.